Hello, my name is Dr. Mariam. Welcome to my patient series. So a lot of the challenges clinicians face in primary healthcare with people with hypertension is on the issue of compliance. A lot of patients with hypertension are reluctant to take their medication because they don't want to accept the fact that they have to take a drug every day for the rest of their lives. Although medications for hypertension may be needed at some point in the treatment, it is not always the case. Early on in the disease, many patients can actually lower their blood pressure without medications at all. Today, I'm going to be sharing with you how you can effectively lower your blood pressure naturally at home without any medication. If you're new here, my name is Dr. Mariam. I am a junior doctor. I make medical videos to help junior doctors navigate easily through the medical life, as well as health videos for the general public. Before we begin, just take a moment to subscribe. It will give me the motivation I need to make more videos like this. So the first step to effectively lower blood pressure naturally is through weight loss. The bigger you are, the harder your heart has to work. The harder your heart works, the more pressure it pumps into your blood with each beat. Reducing even a small amount of weight can help you significantly lower your blood pressure. Research has shown that a 10 kg drop in weight can lower the blood pressure by as much as 5 to 20 millimeters of mercury. That's a lot. The second way to effectively lower the blood pressure without medication is through exercise, which is not the same as weight loss. Whether you're overweight or obese, exercise can help you lower your blood pressure by making your heart stronger. If your heart is stronger, it does half the work. That is, it becomes more efficient. The more efficient it is, the less force it pumps into your blood with each beat. The recommended exercise is usually moderate aerobics, which includes brisk walking, hiking, running, jogging, swimming, dancing, all of that. And it's usually recommended you do that for at least 30 minutes, about 3 to 5 times a week. The third most important way to lower the blood pressure without medication is through decreasing the amount of salt in the diet. Many patients with high blood pressure actually know this fact, but not many patients comply. And part of the reason why is because most patients don't actually understand why. As a clinician, if I tell you to lower your salt intake, I should at least give you a reason why, right? Well, the answer is simple actually. The human body is about 60% water, and most of that water is located inside the cells, with very little being in the blood. The water inside the blood and in the cells has a constant amount of salt that it likes to keep equal between the two compartments. When we eat a diet high in salt, we disrupt that balance by making the salt in the blood higher than that in the cells. And because salt is osmotic, meaning it draws a lot of water, it pulls a lot of water out of the cells and into the blood. This expands the blood volume. An increase in the blood volume leads to an increase in blood pressure. That's why decreasing the amount of salt in the diet is essential in lowering blood pressure. The American Heart Association recommends not taking more than 2.3 grams of salt for healthy individuals and not more than 1.5 grams of salt for patients with high blood pressure. This is a Maggi cube. Very innocent, right? How many do you cook with? Well, 1 cube of Maggi or its other counterparts actually contains about 1 gram of salt per cube. So realistically speaking, if we are following the recommendations for salt intake, that means an average patient with high blood pressure should not be consuming more than 1.5 Maggi cube per day. The fourth important way to lower the blood pressure without medication is through adhering to something called the DASH diet. The DASH diet stands for Dietary Approaches to Stop Hypertension. What the DASH diet is basically adopting a healthier eating habit in general, which can include eating more fruits and vegetables, eating whole grains like brown rice, brown bread, maize, oats, millets, converting from red meat to white meat like fish or chicken, and switching to a low-fat and low-cholesterol diet, which usually means replacing your milk with low-fat milk, low-fat cheese, replacing your oils to extra virgin olive oil, and eating lots of okra or kubewa, which interestingly contains good amount of soluble fiber. It has actually been shown that patients who stuck to the DASH diet alone were actually able to lower their blood pressure in 2 weeks. I'll link a checklist to the DASH diet in the description below so you can download it at the end of the video. Number 5 is increasing potassium intake, which is the opposite for salt, right? So before we mentioned that lower sodium is good for hypertension, but here we're saying high potassium is good for hypertension. So a diet low in potassium has actually been shown to increase the risk of blood pressure as well as increasing the risk for stroke. Increasing potassium in the diet is essential to lowering blood pressure, as potassium relaxes the walls of blood vessels, easing the tension within them, and that decreases blood pressure in general. So eat lots of bananas. It's important to note, however, that this potassium rule applies to patients with healthy kidney function. Patients who have impaired renal function are actually advised by doctors to watch the amount of potassium they eat, as they tend to hold on to potassium more. Other sources of potassium include spinach and other leafy greens, avocados, and sweet potatoes. Another important way to naturally decrease the blood pressure is decreasing the amount of caffeine in the diet. Although caffeine can be beneficial, like keeping us alert, improving brain function, and even aiding in weight loss, it can actually raise the heart rate and narrow our blood vessels, which can both raise the blood pressure. Sources of caffeine include coffee, green tea, black tea, carbonated drinks, and energy drinks. So the FDA actually recommends not taking more than 400 milligrams of caffeine per day. Lastly, to effectively lower blood pressure, habits like smoking and alcohol need to be decreased or ceased in total. Both cigarettes and alcohol not only raise the blood pressure, but increase the risk of other cardiovascular diseases as well as certain cancers. Even in patients who are being treated with medication for their high blood pressure, continuing to take these substances can lead to difficulty in achieving optimal blood pressure control. So in essence, although medications are very important for the management of high blood pressure, lifestyle modification is very important and continues to be first line, as these can not only decrease the blood pressure but can also prevent development of the disease in total. So we've reached the end of our video. If you liked anything I had to say or you benefited from anything I had to say, please let me know in the comment section below and drop me a like. Don't forget to subscribe, as that will give me the motivation I need to be making more videos. Thank you so much for watching, and as always, I'll see you next time. Bye.